there are companies that offer dental insurance to their employees, but it's not offered as a benefit, meaning that they're simply providing the group access that any of their employees can purchase it themselves, and then they arrange it through an employee deduction. That's one aspect, meaning that the employee is actually buying that insurance themselves. Now, there also are individuals that have gone out and acquired dental insurance on their own. It's not easy to acquire dental insurance if you're just an individual, because typically dental insurance doesn't have a good mechanism to deal with individuals. There's not enough economy of scale, for onesie, twosie purchases of insurance. So there actually is a growing group of individuals that have gone out and purchased their own dental insurance, and they're paying for it themselves. And so the tip that I have as a great way to help your patients who are buying their own dental insurance, the truth is that what they have is not a very good benefit to them. Oftentimes they're restricted on their providers. They're often closed panel networks, meaning that the patient cannot go out of network to an out-of-network provider. The premiums are much higher than they should be, because we all know the insurance company are in the business of making a profit.
Yeah.
And they're very good at that. Not good at much else, but they're very, very good at that. And so they overcharge these patients, making the patient think that they got a pretty good deal. And what my suggestion is let these patients know that are buying their own dental insurance that they ought to take a look at your in-office membership plan, because your in-office membership plan is way more beneficial to the patient than whatever it is that they purchased on their own. Think about the benefits of the in-office membership plan, Naren. There's, the way we suggest doing your in-office membership plan is you come up with an annual fee that covers 2 cleanings, exams, and x-rays, 2 hygiene appointments, exams, and x-rays. Come up with an annual fee. Think of that as like your own office Costco card, or your own Amazon Prime card, that you're making available to your patients. And then you come up with a discount, a savings on any service in your practice. And we suggest that savings be 10%. We've done the research on it. We've tested different percentages. And in our research, we've tested 20%, 18%, 15%, 12%, 10%, and 8%. And we've done sophisticated A/B split testing to determine what percent do we need to offer to encourage people to sign up, but have it be as low as possible to minimize the negative impact on the practice.
Right.
And that number is 10%. Now, I don't like the 10% discount. Let me go on record right here as saying, I don't like that 10% discount. But when you compare it to the alternative of the PPO plans, which is more like a 45 to 50% discount, Naren, which would you rather pay as a dental office owner, as a dentist? Would you rather pay 45 to 50% or 10%? Take as long as you like.
10%.
10%.
So as you were speaking, I was thinking of the benefits of this strategy you just shared. Number one is you get extra money in membership fees, right? As a practice owner. So let's say 50 patients, each paying $400, 20 grand a year. Number two is you're not giving up that 45% on the work you do, because you get paid full fees. Of course, they are benefiting from the free cleanings, which you would have done kind of anyway.
Well, actually, they're not free because they're covered by your annual fee.
Exactly. So they're paying for the annual fee and they're getting the free cleaning. So that's not really a downside for you. You're doing it, anyways. Here you're getting paid from the membership fee, as opposed to there you're getting paid from the insurance after all the write-offs. And the third and the biggest benefit is they're going to be a lot more loyal, and they're going to do high value services because they get a blanket 10% off everything. So I want veneers.
And there's no games. For example, we all know with traditional dental insurance, they have all kinds of limitations and provisions in the plan. Like, heaven forbid, your patient would come in 5 months and 29 days after their last hygiene appointment. That claim will be stamped denied by the insurance company because they didn't have a 6-month wait.
Right.
They missed it by a day. But here's the irony of that, Naren. That happens all the time. Any one of our listeners has had that happen to them multiple times because we accidentally didn't pay attention to the 6-month wait, scheduled someone 5 months and 29 days after the last hygiene appointment. And then who is the patient mad at?
The doctor and the team.
Well, they're mad at the team.
Yes.
They're mad at the team. And they should be mad at the insurance company or their employer for buying a policy that had that silly clause, but they're not mad at the insurance company. They're mad at you.
Right.
But in this, if you're designing your plan in the way that we suggested with an annual fee that covers hygiene appointments and necessary x-rays and exams, if you're designing it that way, then it doesn't matter if they came in 5 months and 29, they get 2 a year. So they can come in, I know what I'm about to say doesn't make sense clinically. So if we have any hygienists listening to this, I want to state that I know what I'm about to say doesn't make sense clinically. But if Linda, your patient, wants to come in Tuesday for her first hygiene appointment for the year, and then she wants to come in Thursday for the second one, guess what? She can do that. But it doesn't make sense clinically to do that. Does that make sense, Darren?
Yeah, absolutely. Get it.
Yeah, and Eric, you can do that. You bet you can. And the nice thing about there's no annual limit to the benefits. Most insurance plans have an annual limit that's $1,000, $1,200, $1,500 annual limit. There's no annual limit. That 10% applies on any service in the practice and no annual limit. There's no exclusion, or I recommend you design your plan with no exclusions so that anything, if it's done in your practice, they get that 10% savings if it's done in your practice. So now there's like if we do adult orthodontics, oftentimes with adult orthodontics, most ortho insurance policies have a one-time lifetime benefit. And most adult orthodontic patients have gone through ortho as a teen or a young adult. And as a result, when they have the adult ortho, because they stopped wearing their retainer and the teeth start moving around, they don't get any benefits because they've already used their lifetime benefit for ortho. So in this case now, guess what? They get the 10% savings.
Yeah, exactly.
So it's a great benefit.